Yeah, people will join 5 o'clock. First, I will talk for some time and then I will introduce you your CV and then go on. We are online. Dear Facebook viewers, on behalf of Preeti Urology and Kidney Hospital and Pure Urology, we are conducting this program, primarily a social program, wherein we are discussing about the diet related to women. To be honest, this program is not only related to the women, an idea about the diet, even men can understand by this lecture how the diet should be taken. Primarily, when we talk about the diet and exercise, we usually remember only two things, that is going to gym and heavy weights lifting, and second thing is that not eating anything, eating small amounts of food. But it is not correct. Things have changed a lot. The main idea is today our speaker, Dr. Rashmi, um, who is obstetrician gynecologist from Agra, Dr. Rashmi Chahar Kandelwal. I will introduce officially, and then I will ask her brief questions, how she got interest, and then I will hand over the program to her to know about this topic. Why we have selected speaker is uh, primarily she is a doctor and worked hard all career to become a gynecologist, which is not easy. And she did her MBBS from SN Medical College, Agra, which is a reputed medical college. She did MS and Obstetrics and Gynecology, GVSM Medical College, Kanpur. Consultant and Kandelwal Nursing Home, Agra for last 12 years. Certification in vaginal rejuvenation procedures. Pioneer of radio frequency vaginal rejuvenation therapy via Thermi in North India. Participated as faculty in various regional and national conferences of obstetrics and gynecology. Nutrition and training coach at FITTR, one of the biggest online science-based fitness communities. Second rank holder in National Transformation Challenge 11 of FITTR, and among the top 50 of the Transformation Challenge 10. So with this introduction, I request Dr. Rashmi Madam. Madam, can I have you on the screen, please? Madam, good evening. Unmute, Madam, please.
Good evening, sir. Good evening,
Uh,
everyone.
yeah. Madam, I wanted to ask you briefly, after your obstetrics and gynecology, you went to the private practice directly or you worked somewhere in an organization?
Uh, Directly, if I can say that I came directly to the private practice because my husband was doing his SRship in PGI Chandigarh. So
Okay.
I was there for 6 months only and did SRship for 6 months only in ESI Chandigarh Hospital.
Okay.
And I came back directly to Agra and started my own practice here.
So primarily your husband is a ENT specialist from Chandigarh, PJ Chandigarh. Both of you are at Agra now, doing private practice.
Yeah, our hometown is Agra and we are settled in Agra.
Okay. At what point of time you first looked into your life about the diet and apart from your obstetrics and gynecology practice, which we are not going into the detail today, at what part of time of your life you felt that I need to know something about diet and nutrition?
In 2010, when I delivered my daughter, then I was around 85, 86 kgs. And
Okay.
I'm a patient of severe PCOD since my teenage. So
Okay.
that impact was also there. And after delivery, things were so, difficult for me to perform my day-to-day activity, my professional work, and I was going into, depression also because of such things. Uh, I was not getting socialized with people because of my weight and because of my low self-esteem at that point of time. And most importantly, the thing which was bothering me was that I was not able to take care of my daughter properly and my work properly because of my overweight things and poor stamina and energy. So
Yeah.
at that,
So you at that time, see, normally what we do is go through the internet and see that weight loss programs. So much will say that this program, that program, and we will go and we also get some idea about the diets. Don't eat dosa, idli. They are very ugly. They are very high items. You should eat only fruits, vegetables. Every day you take one tablet of vitamin C. You do exercise. Some show the say six packs abs how to get. Some say jumping, some say running, some say cycling. The only thing is easy is eating, and all other things are difficult. Then, was there any mentor initially to encourage you get into this line, and then we can help you? Everybody needs some teacher to do it apart from our own. What do you think?
absolutely right, sir. As majority of people, I also did so many mistakes in the beginning of my fitness journey because I had no proper knowledge, no proper science based ideas ki how should I progress in terms of fitness. So I also did these things like I was doing hours of continuously cardio just to burn calories, and I was doing starvation literally. And I also did huge mistakes like I used meal replacement shake, which claims to be like very good for weight loss. I did it for 2 to 3 months, but that was a huge mistake of my life. And I at this point of time I realized how ignorant I was at that time, when I had no idea what should be done in a healthy way.
Okay. So similarly, the last point I wanted to ask you before handovering the program to you, that everybody is very keen on their body language. They want to look thin. They want to look slim. They will go to courses, 30 minutes short time course. After that, they realize that they have lost 4 kg and they will be very happy. After that, they say that after 3 months, all useless, I wasted my money. This is a common attitude of many, in fact, women. Men at least they go out, they understand. Sometimes they go to gym. Women predominantly focus on the short courses of diet, and they try to lose weight and suddenly want to look slim. Before we go to the talk, you address this, and then we will go to the talk. I mean, not only women, men also. I am not saying that women only get influenced by the, but majority of the private organizations, I strongly disbelieve whatever happens in 30 days is not sense, because life is 60, 70, 80 years of journey right from the zero of your birth. There is meaning of eating what you are eating, and there is meaning of discipline, and everything is there. Without understanding, 1 month we will reduce, and joining such courses is, what is your opinion?
Yeah, actually, in this era of social media and everything is so easily available, anyone can put anything on social media claiming that we can provide this, we can do this, we can. These all are called yo-yo dieting stuff. Yo-yo is a kind of ball when bounce it back and it just comes back to you with the same force. So whenever you do crash dieting, whenever you starve yourself, you lose weight. It doesn't like you don't lose weight, you lose weight. But for how long you can stay like this? Can you
Yeah,
like this for lifelong? No, you cannot. So your main goal should be, diet part means doesn't mean starving yourself. It always means that what you can follow for lifelong, what you can sustain for lifelong, what you can adhere for lifelong. This is the meaning of diet, which is not conveyed in a proper way by the so-called YouTubers and dietitians, which are not bothered about what you are gaining in long term. They are just giving you crash course, just gains lose 10 kgs in 4 weeks or 6 weeks. So it is not healthy at all, and you cannot sustain it.
okay. So with this, dear friends, whatever the today talk will be for lifelong for you. It's not for one day. As long as you can do it, it is not. Many says that it is not to live 100 years life. it is to live every day healthy. So we thought we will take from the doctor. Very few doctors will take it as personal challenge and sustain for a long time. This is nearly, I hope, that she has gone through a successful journey. Let us listen that journey as well as the principles of diet and exercise today. Thank you very much, madam, for accepting the invitation. Over to you, the program. Thank you.
Thank you, sir. Good evening, everyone.
And
First of all, I would like to thanks Dr. Vadi to give me this opportunity where I can share my learning and knowledge about nutrition and exercise science with all of you. So, in this pandemic, majority of people have started taking their health and fitness very seriously, more than they used to take it earlier. But for me, the diet never means you should starve yourself. So it means whatever you can sustain, whatever you can continue for your lifelong, this is diet. So nutrition and exercise science is itself a very huge subject, and here I would like to keep it very simple and practical. So before beginning, I would say if you have any questions regarding any particular slide, then please let me know. I will stop there and answer your question. And questions we will take in last. So why I respect fit people? You can just have a look at this, picture, because this is one of my favorite quotes. Because fit people with a physique is much more than how good they look. It's not about how you look actually. Fit doesn't mean that you look good only. A well-built physique is a status symbol that reflects your hard work. Obviously, money cannot buy it, nor can you inherit it. You cannot steal it, nor can you borrow it. You cannot hold on to it without constant work, means consistency. It shows dedication, it shows discipline, it shows self respect, it shows dignity. So it shows patience, work ethics, and passion. So being fit is far more than just looks.
second slide will come when you click on this slide, madam. You roll the cursor on this slide and click once. Then the second slide will come. Yeah. Yes.
So, what everyone wants actually, everyone wants to lose weight and more importantly, wants to maintain it forever with our staple favorite food items which we can have daily. That's the most important part of any dieting strategy. So, to do that, what we need? We need the most important factor which I feel, which I have experienced, is consistency. More than anything, is most important than discipline and patience. Not every day you should look in the mirror and see your tummy flap, that when will it go, and when I'll be slim, when I'll be thin. Keep doing consistently. Here I'll talk about motivation also. Motivation works in the beginning of your journey, but when you are fully dedicated into this, then motivation, I don't believe much helps, because uh, whether you are motivated or not, you have to do it consistently, then only you will get the result. Okay, then what's the best diet? I've already said, sir has also mentioned that whatever which we used to eat since our childhood, we want to eat that lifelong. And that's the only way to sustain any diet strategy. We have heard that no, I don't eat rice, I don't eat sugar, I can't eat potatoes because they are fattening. So let me explain this thing to you. There is nothing like bad or good food in general, because rice, sugar, potatoes have particular specific calories. If you are able to adjust these calories in your daily diet, you can easily have them. They are not specifically fattening food items. People are frightened to have these just because it's a myth that they will make you fat. And people say it's 70% diet and 30% workout. No, it's not. It needs 100% both of this. Now, coming to energy balance to understand how weight gain and weight loss occurs. Look at these pictures. There is a energy balance picture in which you can see that when input is more, means when we are eating more than our energy expenditure, then obviously we will get weight. This is simple science. Nothing, difficult to understand this. And if you want to maintain your weight, then your calorie input should be equal to your daily expenditure. And when you want to gain weight, then obviously you have to intake a little more calories than your daily expenditure. Now, coming to particular terms which we come across so many times, like BMR, we all know basal metabolic rate, the minimum energy which our body needs for the basic physiological and metabolic functions. Then there is TDEE. Whenever you are going to calculate your daily caloric requirement through any calculator or any formula, you will come across this term. This is called total daily energy expenditure. In simple words, how much energy you expend. Matlab, what is your output in terms of energy, right? Then comes to NEAT. NEAT is the activity part besides your exercise. There are two types of activity which we include here. One is exercise related, one is non-exercise related, which we used to, do throughout the day, like our work. Even if we are sitting, we are tapping our fingers, we are, moving our hands, we are doing household chores, we are speaking, we are sleeping. These all are included in non-exercise activity. Then comes TEF, thermogenic effect of food. We all know that food digestion also consumes calories. So particular food macros like proteins, carbs, and fats also have different calorie consumption while digestion. So TDE means your total daily calories burning, in simple terms, is equal to four things. It's a sum of four things: BMR plus activity, which includes exercise and non-exercise, both kinds of activities, and the food, what kind of food you are eating. So let me tell you here is TDEE is not a fixed number. It is always dynamic. Even at the same calories, it will not be fixed because BMR is dynamic. Because BMR, being doctors, we know that it is affected by so many things which are always keep changing. So these things are not stable all the times. So let's talk some science. I have already told you total energy burning, total calorie burning, जो हम normal day to day routine में use करते हैं term calorie burning, is equal to BMR plus activity plus food, what kind of food you are eating. And out of this calorie burning throughout the day, BMR constitutes the maximum part. That is 70% of your total calories burning comes from your BMR, which in turn is affected by so many things like what is your diet history, what is your fitness history for over the years, what is your stress levels, and how sound or how much disturbed is your sleep, any diseases, any metabolic disorders, inflammations you're affected with. So these are dynamic factors. So BMR is always keeps on changing. Now comes to activity. It comprises of 20 to 40% part of the energy expenditure in a day. And out of which you will surprised to know that need non-exercise activity is much, much more important than exercise activity. What we do, we perform a complete workout in a day for 1 to 1.5 hours, and then we get relaxed that we have done our workout. Now we can just relax, just we need not to move around. It's not that. It's completely a wrong way. So our aim should be keep on moving. We should be active as much as we can throughout the day besides exercise. Don't count exercise in your NEAT, and don't count NEAT in your exercise. Both are different things, and you should dedicate time differently to both the things. Now, coming to the thermogenic effect of food, TEF, it comprises of 10 to 15% of your total daily calorie burning. Mixed meals with proper macros ratio, having proper protein, carbohydrates, and fats, have maximum TEFs. So, we should focus on having a balanced diet and unprocessed food, fresh food, and unprocessed, I mean, non packaged foods. These have more TEF than the processed and packaged foods. So, our focus should be consuming these type of food more.
Madam, I want to ask previous slide, please. I just
Yes.
wanted to the one factor you told is activity other than exercise is also important. But can we, because you said 70% body requires BMR, for example, doctor with a sedentary lifestyle, even I'm asking for myself, after doing 2 hours exercise, I am thinking that it will be sufficient for my rest of the day. And during surgery and as well as during OPD patients, it consumes very less calories. And I have the lift, so I don't use the stairs. In that case, can this BMR 70% will be affected by your exercise? So that can your BMR be increased with 2 hours of exercise, or that is also uh,
Very long process actually. BMR will be affected by exercise, but not on that particular single day, because it depends on your fitness history over the years, how much lean muscle mass you have. Simple principle is, the more muscle mass you are having, the more energy expenditure you will have, more BMR you will have. So that's why we focus more and more on gaining muscles to
oh,
increase BMR over the period of years. But it takes a lot of time and lot of dedication. If we cannot increase BMR just for a day by increasing exercise.
yeah, I got the point. Okay, madam, please.
Now, coming to the most interesting part, which we all want to know, how to plan our diet to reduce weight, or if someone wants to gain weight or muscles. So, the when let me explain that what is TDE calories. TDE calories are your maintenance calories, means the calories you are consuming and your weight is maintained. So, this is TDE. When you want to lose your weight, or more specifically, I would say when you want to lose your fat, then your calorie intake should be less than your TDE, means less than your maintenance calories. Maintenance calories or TDE is the same thing. So we should not drop our calories drastically from TDE, that we should not go 1000 or 800 calories less than TDE. We should start lowering calories gradually, 200 to 300 calories less than maintenance calories, and then see the progress over the period of 8 to 10 days. Then see how much inches, how much weight you have lost. If you have lost weight, then continue with the same calorie plan. You have to continue the same calorie plan till your weight gets stuck, till your weight get maintained. That means your new maintenance calories have achieved by body. Your TDE has changed now. Now you have to further reduce your calories 200 to 300 to achieve further weight loss. I would use the term weight here because whenever we are, and this is called calorie deficit, means you are consuming less calories than your maintenance calories. You are in a calorie deficit diet plan. This is a term you will come across whenever you will find any diet and calorie tracking formulas. Then weight loss is not always not only fat loss, it always consists of water also, it always consists of muscle mass loss also. That's why we always suggest that we should not reduce our calories drastically, because in this, along with fat, we lose our muscles more also. So it should be gradually. And that's why resistance training, weight training while dropping weight is very, very important to maintain the muscle mass. Otherwise, you will keep on losing muscle mass more with more rate than the fat loss rate. So
Okay.
it's to be in weight training while in weight loss journey. So this is the part of calorie deficit. Now coming to the calorie surplus. Yeah, there's one more point. There are many people who says that I'm eating very, very less, even then my weight is not going a bit down. So this is called metabolic adaptation. Means your body's basic metabolism is not, taking care by the calories you are consuming. You are not even having calories required for the basic metabolic function of the body. You are eating around your BMR or even less than BMR, which is not at all recommended in a scientific way. That's why your weight get stuck or weight get plateau. In these cases, nutritionists follow a proper reverse dieting strategy. That's a different thing. I cannot explain it here because it's a totally different thing and will be a little complicated. So I would suggest here that please don't eat too less. It will not cause weight loss. Rather, it will cause metabolic damage and your weight loss will be plateaued. Now
Yes.
coming to weight loss for weight gain or muscle gain. So likewise, I said in weight loss, it's never only fat loss. It's along with the water content, along with the muscle content. So here also, we never gain muscles only. It's very, very difficult. So we also gain fat also along with the muscles. So our aim here is that we should gain minimal fat along with the muscles. And that is why here we planned our calorie surplus, means more calories than our maintenance calories, in a very gradual and planned way. It's not that you have to eat more calories to gain muscles and gain weight so you can hog on anything. No, you cannot, because it will lead to dirty bulking, means you will end up in having more or more fat rather than muscles. So again, you will be, like kind of stuff yo-yo dieting. So you will lose and gain. You will uh, in a vicious cycle. So in whenever you are planning your diet, 2 to 3 points we have to, first you have to choose your calories. Then out of these calories, you have to calculate protein. First of all, we have to calculate protein. This is the minimum protein I have written here. However, if you are in good strength training kind of stuff, then you should have 1.2 to 1.5 or 1.6 grams per kg body weight minimum. And it goes even more for high intensity workout people who are doing this. And fat should be zero point 0.6 to zero point 0.8 gram per kg body weight. That should be the minimum fat. It can be more also, but this minimum we have to keep. And rest calories we calculate from the carbohydrates. I think everything is clear here. If
Yeah, yeah,
any.
yeah. Whenever we talk about point 2 to point 0.8 and 1 to 1, people will slightly withdrawal mode will be there. Anyway, further slides will explain that. For the audience, the grams per kg means they have to understand it is truth, how this can be done in practical life. Anyway, your further slides will speak on it. Continue, madam.
So this is a practical thing now. Okay, how to estimate TDE and plan diet. So these are the formulas, but how to do it? So TDE means, I already told you, maintenance calories, means you are not losing, you are not gaining weight at this calorie. So this is your maintenance calorie.
Yeah.
There are various formula and calculators online through which you can just put your body measurements, your body details, and you will get what is your TDE. This is a very easy way to find out TDE or your maintenance calories, through which you can, plan your diet. But these formula and calculators are not very precise and not very accurate. So what we do, we don't use these calculators or formula. We take diet history of the person. What is diet history? We ask the person, if someone is coming to me to diet planning, then I'll ask him to chart out his 2 to 3 days routine diet and mention whatever he is eating daily, routinely. So I'll, have an estimate of average daily calorie intake through his diet history. And then I'll see on this diet, the particular person, whether he is increasing weight, decreasing weight, or maintaining the weight. That will give me idea that these calories are his maintenance calories if he's maintaining, or if the person is in deficit if he's losing weight, or the person is gaining if and that means the calories he is having are more than his maintenance calories. So diet history is a more accurate way to find out the TDE. We can never accurately calculate TDE. We can only estimate the approximate thing. We can never, just accurate TDE can never be calculated through calculators or through anything. So now comes in the picture is quantified nutrition. Accuracy means quantified nutrition. In the previous slide, as mentioned, that specifically we are talking about protein this much, fat this much. Uh, this means quantified nutrition. This means accuracy. So what is quantified nutrition? In quantified nutrition, what we do, we measure our food items. Am I audible? Hanji sir. Yeah.
Hello, madam. Sorry very much. Very rarely current goes. Hello. Yeah, yeah. Please go to previous slide, madam. I will tell you exactly where we are on line actually to the public, but my current has gone. Very rare. Can you go to the previous slide, madam? Very, sorry, sorry. Next, previous slide. Previous slide. Sorry. Wait. Next. Calorie deficit, quantified nutrition. Next, what is quantified nutrition? From here we have to go, madam. How to estimate what is quantified nutrition? You have to go from here. Sorry, the audience. We will continue, please.
Okay, so we will be talking about now the most scientific method of planning. What is quantified nutrition? What we do in quantified nutrition means quantifying your nutrition, means measuring it accurately. So accurately measurement, when we measure the food items in raw and uncooked form. So kindly pay attention to these words. Quantified nutrition means measuring the food items before cooking them in raw form. For example, if I am going to have one chapati today in my lunch, then I will measure the wheat flour before making it dough, and then I will prepare dough from it, then I will prepare chapati from it. So this is the basics of quantified nutrition. To track calories, micronutrients, and micronutrients, that's the most scientific and most accurate way. And what are macronutrients and their ratios in balanced diet is, I have mentioned earlier also, like 30 to 35% is fats, 60, 65, 70 depends upon is carbohydrates ratio, and 30% approximately is protein ratio. And if we talk in terms of grams per kg body weight for the particular person, then I have mentioned that protein minimum should be 1 to 1.2 gram per kg body weight, and fat minimum zero point zero zero 0.6 to zero point 0.8 gram per kg body weight. And carbs, we always play with the carbs, because these proteins and fat macros we have to adjust first in planning the diet, then we comes to the carbs. So this is the most scientific way to track your calories, and that's why the most effective method for fat loss. This works like magic, and how it works like magic, I will show you in coming slides. How to do this, how to plan diet, how to plan the ratios of macronutrients in our diet planning. So for this we have to use apps. I don't know about other apps, because I have been using FITTR app for last 1.5 year. So the diet tool in the app is so accurate, and it perfectly gives you the amount of carbohydrates, fats, and proteins according to your proportional calories that you adjust in the tool. There are so many tutorials on the YouTube, on the FITTR app channel YouTube, that you will get to know. You will get to learn how to use diet tool and prepare diet chart from the FITTR app. You can go through them and plan your own. Any questions from this slide?
Basically, in Twitter app, we we have to directly go and enter your details, or you can view directly the video.
On YouTube, you can directly view without making any profile or something. But on Twitter app, you have to download either from Android or for Apple, and then you have to make your profile there. You have to fill all your measurements there. Your goal, what you want to lose weight, you want to gain muscles, whatever you want. Then accordingly, the app will give you a default diet plan, which is totally free without any subscription. And how to make customize that plan according to your different goals, you can go to YouTube channels, which is not it is not required there to fulfill all the profile things and all.
Yeah,
YouTube, you can.
understood. Understood.
What are the benefits of quantified nutrition? As being doctors, we all know that our body is all about numbers, starting from respiration to blood pressure to temperature to height, body weight, everything is about numbers. So this is called accuracy. So quantified is an accurate way to achieve your goals, the most healthy and scientific way. It doesn't work that I should eat this much, or I should not eat this much. If I will eat one ice cream, will I gain weight or something like? There's no guesswork. This is accurate way to measure your diet, perfect manage weight and muscle mass, and use food relationship. Food relationship I'll explain here in detail. Many people have fear of eating few food items, like they like desserts, they like potatoes, they like sweets, but they don't want to eat, they cannot eat because they have a fear that they will gain weight. So this is called food relationship. You can are able to quantify your calories. You can eat your favorite food items, have a psychological relief. You will have, a happy mental condition that yes, I can have what I really want. So this helps bring a positive mood relationship. And then dietary will also help you because you are all the proper nutrients. There are many like if I talk about my competition when I was preparing for the transformation challenge, I was on low calories. At that time, my coach provided me potatoes and bananas. Can you believe this? People will say, what kind of dieting is this for weight loss where you are having bananas and potatoes? Yes, because these have, and rice too. I am eating rice for continuously for 1.5 to 2 years because these have high satiety index. With low calories, these food give you good satiety, stops your cravings, control your cravings. So please stop thinking that these are fattening things. Now coming to the myths and misconceptions about timings and frequency of meals. We have heard many times from many people that keep on eating 6 to 7 meals a day. This will help in losing weight. I would say if your calorie intake is same in either the 6 meals, or you are dividing it in 2 meals, or you are having all the calories of your day in single one meal, then there is nothing going to change in terms of weight. If you are in calorie deficit plan and those calories you are consuming either in 6 meals or in one meal or in two or in 3 meals, your weight will lose definitely. This is science. Number of meals is not going to change the calories of particular food items. If you are dividing it, I'm talking about the pay attention to the word provided with the same calories. And eating carbs at night makes you fat. So this is a very debatable kind of thing. If we talk about science, eating carbs, let's say if we are eating 100 gram potatoes or one 60 gram flour chapati at night, are the calories going to change if we are eating it in the morning, or the calories will be different if we are eating in the night? No. The thing what practically is related to this sentence is that sometimes if we are eating late dinners, then these causes digestive issues with some people, and that's why their sleep is get disturbed. When sleep is disturbed, digestion is impaired, and overall their weight loss journey gets impaired. But the particular food item doesn't make you fat just by eating it at the night.
Okay, very important point. Okay.
So, when coming to quantified nutrition, the major problem we as coaches feel that people don't want to measure their food. What is this way of eating food, measuring every time and cooking it separately? They are not ready, or it's not, rather I would say it's not feasible for many to
Yeah.
manage this thing. They are living in a joint family, they don't have cook, they are working professionals. So how to manage in such cases? So what we suggest in these situations, I would say that try to do it for at least 1 week. And what you have to do, for example, in breakfast, you are having a 50 grams poha I have given you, or 50 grams bread I have given you, or 50 grams flour I have given you. Suppose you are having 50 grams poha, then you measure it raw and then cook it, then measure it in the cooked form and write it down somewhere. That in my diet plan, my coach has given me 50 grams poha. So I will measure it raw first in uncooked form, then I will cook it, and then I will measure it again, so that your table will be prepared regarding your diet stuff. And same with the other things also. If you are having 50-gram rice, 30-gram dal, then measure them first raw, then measure after cooking, and write it down somewhere. So what you can do when you are taking out your portion from the total cooked food, from family's food, then you can take out your cooked portion from that particular food item. Getting my point? Any confusion,
Yes,
sir?
yes, sir. Very clear, because every time you cannot yourself in the family cook according to weight. You are telling that for your proportion, you you make the uncooked and cooked separately and have an idea in 1 week. After that, you follow and remove that cooked proportion to your plate.
Exactly.
Yeah.
Or, what else? Some people are not able to do. Some students are there out. They are living in hostels, and some, so they are not able to do this thing also. So what we suggest them? We suggest them, if they want to lose fat, then they should have particular utensils for their food, that they are taking the dal every day in same bowl, rice every day in same plate in the same quantity. So this is called portion control. We try to teach them that use the same utensils every day and try to reduce the same amount, uh, s- and try to eat cooked food in the same amount every day. This is called portion control. So that way also you can track your calories. However, this will not give you the best results. This will not give you the results in the desired time. It will take a little longer, but this
Okay.
can also be done.
Yeah.
Many times when people are on weight loss journey, there is a problem with the cravings. There is problem that they tend to overeat. So this picture has 3 to 4 points which shows that how can you control your overeating. So first of all, what I do, that I don't keep craving food things which I like very much in my room. I keep them away, so that I need to make efforts to get up and go down to the another floor to the kitchen to get them. So many times I think, okay, let it be, just leave it. So just keep overly tempting food out of your reach, not easily reachable. Wait 15 to 20 minutes before eating more. What happens? We all know that our satiety center gets activated after 20 minutes of eating. So we till the satiety center gets activated, we keep on eating, keep on eating. However, we don't need that extra food. And many times, trust me and try to observe this, try to analyze this. Many times, more than 75% times, when we are feeling hunger, it's not hunger, it's majorly thirst. Try to analyze this. We are thirsty at that time. Drink water and feel. Third point is plan your daily meals ahead of time. Many times, what happens? We come from the work, we come, we are busy throughout the day, and then we see what should we eat now, what should we eat now. And if our meal is not prepared, is not pre prepared, we end up in eating anything which we should not. Like we end up in munching namkeens or biscuits, which we should not. So plan your daily meals ahead of time. You can always get back on track. This is very important actually. If you have, you have done binging, you have uh, cheated on your diet plans, so please don't get stressed, don't feel guilty about this thing for the next 3 to 4 days. And so this is just like creating stress hormones and cortisol levels high in your body, and again creating a negative environment for your weight loss journey. So just forget it and move back to the track as soon as possible. Just leave that there only. Don't think about much of what I've done. These are few things I'm going to discuss which are very underrated in fitness journey. We talk about exercise, we talk about diet, but how many of us think about sleep, water, and stress levels? Trust me, these are equally important. Sleep is the natural fat loss supplement. There are so many studies, there are so many RCTs which shows that if your average sleep hour less than 6 hours, then over the years your metabolism, your overall health is going to be impaired. If your sleep hours are poor, then one study shows that it was a meta-analysis that there will be more muscle loss and fat loss will be decreased by 55%. See the number 55% just with disturbed sleep, just with improper sleep. So please give attention to the sleep hours. Be focused on sleep also if you want to have a healthy fitness journey. And what else? Sleep. When we don't sleep on time, we feel cravings, we feel hungry, and we land up in binging, cheat meals, then again guilt, then we lose track. So it's a vicious cycle. So overall sleep, as doctor also we know that sleep, how it is important in our health journey. Now coming to the water, we all know that water is the major component of our body, so it is required for each and every function of the body, each and every metabolic reaction of the body. So here I would suggest 4 to 5 liters of water is must. If I am uh, having 6 to 7 liters of water every day, which many people thinks how is it possible? But it is possible once you gradually, develop a habit of having water before start feeling thirsty. Then you can keep your you keep hydrated in proper way, and it will affect your fitness journey in a very positive way. Now coming to the stress levels, which is inevitable. We cannot do much about this thing, but we should understand that stress can negatively affect your fitness journey more than you can ever think of. So these 3 points are very important, equally important as diet and exercise. So please pay attention to these. These are various diet names and strategies we have heard about, like keto dieting, intermittent fasting, low carb diet, crash diet. And there are so many myths around, like we can lose weight with the morning lemon, honey water, apple cider vinegar, green tea, etc. So, one line I would like to say for all these things, these are different diet strategies. Actually, people follow these as per their convenience, as per their timings, and availability of food items, availability of their working hours. But these particular things will not work in losing weight if your overall calorie consumption is not in deficit. So calorie deficit is the master strategies can be, any of these, but if there is no calorie deficit, you will not lose your weight. So whether you are trying to do intermittent fasting, whether you're trying to do keto, anything, if your overall calorie consumption is more than your maintenance calories, you will not lose weight.
Okay.
Any questions regarding diet part?
At the end we will take, madam, no problem.
Okay. So now coming to the exercises. Exercises, there are so many exercises nowadays. You can see so many YouTubers and Instagram influencers. There's, huge mm, uh, variety of exercises, but I would say stick to the basics. Then only you will be stronger. Don't change your exercise schedule very frequently. Don't do very fancy kind of things which are shown in Instagram and everywhere. Just stick to the basics. That will only make you strong and progressive. So in exercises, resistance trainings have upper hand. If we talk about other form of exercises, then in research it has shown that resistance training has upper hand. Yoga, flexibility related, and there are various benefits of yoga. Cardio and calisthenics, these are the main exercises which we do follow. And calisthenics means where body weight is used rather than many equipments or machines. So what should be your ideal exercise plan? Ideal exercise plan, as you can see in my picture, that weightlifting, cardio, and flexibility means yoga. This is the ideal. There should always be a combination of things. And you can always do whatever you love to do little more. Don't quit that thing which you enjoy. Never ever do that. Otherwise, you will not be able to sustain with your exercise plan. But try to incorporate other forms also. Then only it will be a perfect exercise plan for you.
Yes.
What is resistance training? It is also known as strength training or weight training. A well structured plan of exercise in which muscles work against any kind of resistance. And this resistance can be your own body weight. There can be free weights like resistant bands, dumbbells, barbells, and there can be machines in the gyms. It's also known as weight training. So, any kind of strength training, any kind of exercise, there are main three components. I would just convey here that never ever start your main workout plan without 5 to 10 minutes of warm up. Warm up is equally important as the main workout plan. Never ever jump directly into the main workout. Uh, just 5 to 10 minutes of quick general body warm up is very important. It increases the muscle blood flow. It decreases the chances of injuries during workout. It increases your flexibility. And don't ever jump directly to the workout. Then coming to the workout plan, which is majorly is a combination of weight training and cardio. And third, never ever go home without cooling down and without stretching. So warm up before workout and stretches after workout are very important. Never ignore these because this will lead to injuries otherwise. And stretches, it's not just that you have to go very fast through this phase. You have to do proper stretches and hold at least for 10 counts, whatever stretches you are doing. So for a beginner, they are very confused that how should we go for an exercise? How should we plan our exercise plan? So I would say just go easy. Don't jump directly for 6 to 7 days heavy weight training programs. You will end up in injuries and you will be demotivated then, and you will quit. You will give up. So start gradually with minimal weights with 20 to 30 minutes per day. And if we talk about frequency throughout the week, then you can start with like 2 to 3 times a week is a sweet spot for beginners for good progression. Here, just listen to your body, see your stamina, your energy, and then progress gradually. You can increase the timing of the session per day. You can increase the frequency from 3 to 4 to 5 to 6 per week. So this is the way to start. And recovery. People wants to do enthusiastically more and more. But not always overdoing is good. It can lead to injuries. It will not let your muscles get recovered. So your exercise performance will be poor, your muscles will be sored throughout, and you will not feel again to go for exercise. So give importance to recovery equally. It is very, very important. Like who train very hard, who lift very good weight in the gyms, they take 48 to 72 hours of rest period just to make their muscles good recovery. So it's very important to focus on recovery also. So why resistance training? Why we want to do resistance training? Why it is upper hand on other things? So this is a picture. You just can go through the points. Like it burns. I've mentioned in the early, like resistance training helps in building more muscle mass, more lean mass, and helps in losing fat. So more muscle mass, you have more metabolism, you have more calories you burn, and it during exercise and after exercise, like up to 36 to 48 hours, up to 72 hours in intermediate and advanced lifters, your body keeps on burning calories after weight training. It makes you stronger. Your joints, your connective tissue, your muscles, everything gets strong. You look good, you look toned and defined. It helps in your sleep pattern. It increases your BMR, strengthens your immune system, reduces your risk of injury. When your bones, your tissues, your muscles are strong, then obviously there are less chances of injury. It increases your energy and stamina, and more, as well as mental health also gets very, very improved after indulging in resistance training. And this is seen by myself only. There are many more benefits, but I think you get my point. Lifting is important. As doctors, we know that there are many lifestyle disorders in which exercise and proper nutrition has major role in treatment. So it helps in minimizing our prescription length. Take some time to counsel the patient regarding lifestyle changes. We know that most of the lifestyle disorders can be managed with all these things. So this is, to give the long-term benefits to patients who are with lifestyle disorders. So we can just utilize this. Now, coming to the menstrual cycle and exercise. Follicular phase, or I would say the second half of the, if we skip the first 5 to 6 days of the cycle, that is the menstruation part. If we talk about the most strongest period of the menstrual cycle, then females feel most strong during the 7th to 14th or 15th day of a menstrual cycle. So this is the time when you can lift heavy, you can do exercise with good stamina, good energy, because there is less fatigue in second half of this second week of the cycle, from fifth, sixth day to 14th, 15th day. So take advantage of that. Do a good exercise with a high intensity in these days. And in these days, carbohydrate utilization is also very good in body because of high insulin sensitivity. So that's why you can use these carbohydrate energy to perform good exercises. So practically, actually, it's variable from person to person. Many females don't feel comfortable performing exercises while menstruation, but many doesn't feel anything. So this is very subjective also. However, there is enough evidence to show us that menstrual cycle phases have not much effect on the athletic performance of the female athletes, but it's subjective practically. Now coming to the misconceptions we used to hear from females, that I don't want to lift heavy weights, I don't want to look bulky, I don't want to look masculine. So let me explain, it's not as easy as you think. It takes life, takes years of years, a tremendous of hard work, and to the point accurate hypertrophic nutrition to gain muscle mass. It's not that you are going to gym for 3 to 4 years with 5 to 6 kgs dumbbells and you will look masculine. No, it's not. If it would have been so easy, then a lot many of fitness freaks would have been very happy. But it's not that. In fact, become stronger, lean, and less prone to injuries. So lift heavy. Don't worry about this misconception. And what we gain from muscle mass, as I told, more muscle mass, more energy expenditure means more fat loss, means we have high maintenance calories. When we have high maintenance calories, then obviously we can have more calories. We can eat whatever we want. So that's what we all want, to have more and more calories and to enjoy our favorite food. Another misconception we have heard a lot. I just want to reduce this tummy fat. Rest of the body is fine, but I just want to reduce this tummy fat. I just want to reduce love handles. I just want to reduce double chin. So sorry to break your heart, but that's not possible. There is nothing like spot reduction in science. So the idea is when you are losing fat, your overall body fat percentage will come down. Your fat from all the areas of your body, obviously more from the areas where it is more and less from the areas where it is less, will come down. So it's not going to do any help to you if you are thinking that I will do thousands of crunches, hundreds of crunches every day and I will have six packs abs. No, it will not happen because spot reduction is not a science thing. Another misconception, now I have started exercising, I have started weight training and cardio, so I can eat as much as I want. No, you cannot, because you cannot negate the calorie in and calorie out science. A bad diet can never outrun your exercise. So remember this thing. What happens? Many people start gymming, starts exercising, and they start eating more. So this should not be there. So please understand the concept behind calories in and calories out. Understand the concept behind science behind energy balance, and don't ruin your workout by hogging on. Now, how to track the progress? People are obsessed with weight scales. If their weight is not going down, then they are very much stressed and they are like, no, nothing is happening and I'm just wasting my money and time and energy. It's not that. There are so many other parameters to track your progress besides weight. Weighing scale is something we okay, take into consideration, but there are other important things as equal as weight are, like body measurements in inches or in centimeters, pictures of before and after. Always do this. You will find, definitely you will find a positive change if you are doing it consistently. Look into your energy and stamina improvement. Look how far you have come in terms of energy and stamina. Look how you feel overall, how you feel. Do you feel happy? Do you feel good? Do you feel positive? So these are the parameters of a positive progress, not only the weighing scale. Even if we talk about weight, there are day-to-day fluctuations in weight scale. So who are used to take weight daily, they get stressed because of these daily fluctuations. These are very normal and are affected by so many things. So like in menstrual cycle phase also, in second half there is little water retention, so there is weight gain. If you have a heavy meal a previous night with large quantity of carbohydrates, then you will have more weight in the morning, but it is temporary because more carbohydrate leads to more water retention. So it's just water weight, it's not fat. All of it not is fat. Stress levels obviously causes temporary fluctuations in the weight. If you are not having a proper sleep, then your weight fluctuations will be there. Dehydration. The more you are dehydrated, more water retention will be there in body. So please keep hydrated. Salt intake. If there is more salt intake, then water retention will be there and your weight fluctuations will be there. Activity levels also affect the water retention. Sometimes very vigorous, high intensity exercises also leads to temporary, correction of the weight scale. Digestive issues. So these are few things which increases weight scale temporarily. So don't get bothered about these. Just be consistent. This is a single slide of NEAT. Actually, we have discussed a NEAT a little earlier also, but I would like to emphasize a little more on this part because we many times overlook the importance of NEAT, which is a wrong thing actually. Non-exercise activity thermogenesis. It is 20 to 25% of daily calorie expenditure. If you want to eat more, then please keep on moving. Be active throughout the day. Don't count exercise in this. Exercise is separate. So NEAT is very important in fat loss. Everyone is busy in this world. It's all about how you manage and what you want and how badly you want, what you can do to achieve that goal of yours, what makes you happy. Don't ever feel guilty to make yourself happy, to do things which makes you happy, because I believe if I am happy, I am fit and healthy, then only I'll be able to take care of my family, then only I will be able to keep my family happy and the society around me happy. So this is a separate slide about FITTR app. You can download it from Play Store or from iOS Store. So it's very easy to track calories, make diet plans, exercise plans. As soon as you fill all the body measurements of yours, you will get a default plan from in the My Plan section, and there is a Get Shredded document. Get Shredded to get shred, there is a document in the FITTR app which is all the basics, whatever I have just mentioned in my slides. It's all there in the Get Shredded document. You can go through that document and go through the YouTube tutorials of FITTR app, how to plan diet and exercise. Learn there and apply on yourself. You will feel good about it. So it's all about priorities. It's not that we don't have time. All of us have those 24 hours, and we have to manage things in that time only. So to change your life, you need to change your priorities. Nothing is shortcut. You have to work consistently. So let's talk about takeaway. Eat less than your maintenance calories means follow calorie deficit diet. Enough protein should be there. This is in terms of grams per kg. And if I would say total protein per meal, then please keep at least 20-gram protein per meal. If we talk about three major meals in a day, then please keep 20 to 25-gram minimum protein in every meal. 3 to 5 days of resistance training with intelligently used cardio, and it should be increased progressively. Don't change your exercise routine, exercise plan very frequently. Stick to the basics. Be more active. Complete your daily 9 to 10,000 steps. One more thing here I would like to mention, that don't rely totally on the fitness tracker apps. Okay, the calorie expenditure shows in these apps, even in the very good branded watches, these are not accurate, because even if you are doing 1 to 1.5 hour to 2 hours of high intensity vigorous workout, high weight training, then also you will burn around somewhere 400 300 calories, and these trackers show that we burn around 900 800 calories in just a moderate intensity workout. So don't rely on these trackers. Yes, you can use them for other things like tracking your steps, tracking your hydration levels and other things, sleep pattern, but not for the calorie expenditure. Hydrate well, 4 to 5 liters of water daily. Sleep well. Don't underestimate the power of sleep in fitness journey. 7 to 8 hours sound sleep is your natural anabolic steroid for bodybuilding and for being fit. And most important, there are no shortcuts. If you want something, then you have to work for it. No other person can do it for you. You only have to do it for yourself. Just be consistent. Thank you.
Thank you very much, madam. There are nearly 220 audience in the view. That's good that they are interested. I like to ask questions. I like to share the questions also. Before that, with your permission, you have put a nice the where is the PPT? Um, am I able to? Are you able to see my PPT, madam?
No, I'm not able to.
We have not shared, sir.
Okay, I will share it. I will share the screen. Your video was there. Can I play that, which you have kept in your journey?
Yes, definitely.
After that, I will go for the questions.
Yes, sir.
A lot of people appreciated the messages you cannot see. I will send you later on. This is a video madam has kept it for the motivation. As she said, motivation cannot be done for a long time. For those who have come, she is the gynecologist and obstetrician from reputed colleges, SN Medical College Agra, as well as GSBM Medical College Kanpur. This is a video she has shown. A lot of people may not accept.
Hello friends, I am Dr.Rashmi Chahar. I am a gynecologist practicing in Agra. Today I am going to share my fitness journey since my childhood till now with all of you. So if I talk about my childhood and my teenage, I was like any other child who are not bothered about what they are eating and what is their diet and nutrition profile. But when I entered MBBS, I landed up in polycystic ovarian disease. I kept on gaining weight because I was living a very hectic life. There was 24, 48, 36 hours duties, and we had, like any other hostel, we had only mess meals. And then in 2010, I delivered my baby. I was 85 kgs. I was not able to take care of my child properly because of poor stamina, poor energy. So that was the time when I thought, no, something has to be done now. This is the high time. So I started with swimming, and I started with a meal replacement shake. So today I think that that was the biggest mistake in terms of dieting. Then I joined a group of my friends who used to do bodyweight exercises. I was not doing any significant weight training. I was just doing bodyweight exercises along with lots of cardio. In 2019, I came across FITTR on Facebook. So I would like to confess this, that in spite of being a doctor, there were so many myths and misconceptions about nutrition. Then I enrolled under my coach Akash Rochlani, and that was the turning point of my fitness journey. And so lockdown was there, so I was not able to go to gym. So I bought some weights and plates for home workouts. Then Akash told me about TC10. Then till the end of TC10, I ended up with losing lot of fat, and I was at the leanest phase of my life, and I was in top 50 at enjoying it a lot. And I was on the path of increasing my strength. And TC11 results, oh my god, I was second, and that's, it's a lifetime memory for me. And thank you, FITTR, for everything. So after TC11 also, I'm still under Akash Rochlani, my coach, and my journey is still going on. All are so blessed that we have such community which is providing a scientific basis to change lives in a very, very, healthy and normal way. So keep grinding. All the best. Thank you.
Now we will take the questions, madam. First question was asked by Dr. Gayatri in Nagpur. I don't know. It's a, hi Rashmi, wonderful discussion so far. Congratulations. Tell me how much cardio along with strength training should be done.
If you are doing 1 hour of strength training, like two muscles per day, and the two muscles, uh, every muscle group twice a week is your frequency, then you can incorporate cardio, or for 2 to 3 days in a week, for 10 to 15 days, that should be moderate intensity cardio. And in fact, I would suggest keep cardio on a separate time from your resistance training. It would be better. If you don't have that feasibility or time availability, then always keep your cardio after finishing your weight training session. You need not to do very high intensity cardio, or just hours of cardio. It's 10 to 15 minutes of low intensity to moderate cardio 2 to 3 times a week after your weight training session is more than enough.
Rekha Tandon asked, weightlifting exercise should always be supervised to begin with, or we can do alone. What is the ratio of weightlifting and cardio exercise, which I already answered. Uh, she is asking, is the gym master or something, that type of person is necessary or not?
See, it's always good to get mentored by someone, because for the beginners, weight is the secondary thing. The most important thing is the right technique and right form of performing any kind of exercise. So what you can do is you just go through. There are hundreds of authentic video tutorials on YouTube about any particular kind of exercise, explaining all those angles and alignments or biomechanics of the body. So just go through that, and then always make your own videos while performing exercises, and then compare where you are wrong, what you are doing right, what you are doing mistakes, because form and technique is the most important thing. Don't go with the weight if you are a beginner. Just focus on the mind muscle connection while performing the exercise, and right technique.
Okay, madam. Quick questions I will take, maybe last 5 minutes of time. Uh, First question, an important question for the Indian, especially South Indian women. Women has the power that, because most of the times they are also involved in the cooking, 90% of the times, or they cook. So if someone asks you, without changing any diet of what they are cooking, if they reduce the quantity according to the protein carbohydrate, can they do calorie deficit or not?
Yes, definitely. That's what I mentioned in portion control. This is what we do in quantified nutrition. If you are able to measure raw food, that's wonderful. If you are not, then don't worry. You can just, reduce your food quantity, and continue with that. You can do but increasing protein, matching the protein requirement is very, very important.
Okay, madam. Some of the questions may look foolish, but I am asking you. Tell 5 to 6 common protein diets eaten in India. Quick, please. Don't mind.
No, no.
This is again lack of attitude, but everybody wants quick
Yeah.
information. Quick. I'm not saying quick results. Quick information they want. Information also requires time. So because this is a one-time program, we cannot do again and again. A lot of audience are watching. Quick diets on protein, which you say very. You said 20 grams. Tell five to six diets, common Indian diets, which contains good protein.
See,
Good carbohydrate, everybody knows.
for non-vegetarians, consuming proper protein is not at all issue, because they can consume eggs, they can consume chicken, meat, anything. So I will talk about vegetarian stuff.
Yes, madam. Yes, madam.
So we have milk and milk products, cheese. But what I, because I am a complete
Okay,
vegetarian,
okay. Common.
paneer, pulses, legumes, and soya. Soya is wonderful source of protein, and
Soya is that soya bean you are telling?
Soya chunks and soya granules. You can mix them in your wheat flour to make chapatis. You can mix in rice to make pulao. You can mix in any kind of vegetables. And there are various recipes of soya
Okay.
available.
That I am not going to tell. Third question. What are the five diets which keeps your satiety when you are in peak of practice? For example, I face at 1 o'clock all the problem in my OPD. Again, I face at 8 o'clock at my OPD. I have to do up to 9. 90% of the busy practitioners will be very busy at 1 o'clock without eating. At 3 o'clock, they eat lump sum. At 10 o'clock, they eat lump sum and sleep. I have changed, but I'm asking you what this is again quick questions may look irrelevant for an expert like you, but just to start at 1 o'clock and 8 o'clock, five diets you tell which can keep you calm and reduce your appetite at the same time give calories.
Okay, so I would suggest you can go for low calorie, high protein snacks like soya chunks. You can keep roasted them with
Okay.
salt and pepper, and you can have potato chaat. You can have very handy bananas. Bananas have very high satiety index, and
Okay.
have proper satiety foods in breakfast so that you won't end up in having too much cravings at the time of 1 o'clock, and have your dinner at the time of too much craving so that you won't end up in binging and having anything.
Okay.
And water. That's very important.
The water you said very fantastic. Fourth question: what are the diets after doing so much hard work you never like to take? Honest, be honest. Definitely, you say that no, 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 you can eat anything. There should be some diets
No,
which you avoid. Let me finish my one diet. The beautiful video by famous hero Akshay Khanna says that if you are not eating outside food enough, this is the one sentence he said. Like that, you also add five items which are not so good for the health.
once in a while you can have anything, but obviously you cannot have pizza every day. I like garlic bread very much. I have cheese every day. I eat 2 to 3 cheese slices every day, but not garlic bread with cheese. I can have every day. Not chole bhatura. I cannot have every day because it is fried and lots of calories. But yeah, once in a month I can adjust in my calories and have.
So predominantly, a lot of people say pizza is not good, and too much chole they say that's not good, and the too much masala. See, for example, chicken. If you say our preparations contain ginger, oil, lot of masala, in which chicken will be one piece in the center, and you will have all this masala. Again, this dry weight will come into picture there exactly, but what is your comment on that wet part of the masala, wet part of it?
To quantify. I like sweets very much. I like aloo ka paratha very much, and I eat aloo ka paratha on alternate day within my calories because I have potatoes, I have wheat flour, so I am making aloo ka paratha. If I like to have some samosa kind of thing, then I do air fry with. I don't deep fry them. I do air fry, and I eat everything within my calories. This is the beauty of quantified nutrition. You can have your daily favorite food items, not obviously fried always, without any guilt.
One more important tricky question. Most of those who are in nutrition specialists, those who are maintaining very balanced diet and disciplined, they look very thin. The jaw angle is very sharp, and they will not have any cheeks. An Indian mother says that the resistance during the infections will be less, and photos also sometimes you look too thin as if you got some problem. So if you are in between fat and in between total cheekless face, is it any proof that total cheekless face and a sharp jaw will have very beautiful life and their stamina, their efficiency, success, everything will be better, or it is not like that?
Yes, yes. Why not? You can. I have one wonderful, not only one. I have more than I have numerous wonderful examples of muscular, lean bodies with sharp jaws and very high immunity and resistance. And one is the CEO of FITTR, Jitendra Choksi. You can just Google his physique and just see him what he is.
Even Pichai looks like very thin and
Yeah,
high performers also will have very keen eye on the diet and maintenance.
beauty definition is very subjective.
Objective. I mean, I am asking these. They have good immunity, no? They say that too much fat God also has given during admissions. This will help.
Excess fat they have removed. They have not removed the essential fat.
Essential fat. So you are depending on that correctly. That you should have fat a little bit on your body.
Logical answer.
Yeah.
Essentially, they still have.
Last few questions. If you eat apart from the eating, two common bad habits. I want your comment. One is coffee, another is alcohol. This is not only related to men. But every coach asks first no alcohol. There is no doubt, should not be discussed. But still, a comment on coffee and alcohol, if you give, it's good for us. Many of the females doesn't take. It may be more information for the men.
In my opinion, in case I would say just say no without any second thinking. It's first is smoking, second is alcohol. Smoking is topmost. Caffeine, I would not say. Caffeine is one of the most researched. I'm not talking about coffee because there's a difference in coffee and caffeine. Caffeine is one of the most researched and most one of the safe supplements which enhances your boosts your performance during exercise. So I would not say coffee is bad.
Yeah.
And if it's required in quantified manner, you cannot have so much of coffee and caffeine like per day. There is a limit to that.
Again, an irritating question. If somebody takes that I want to have one peg of alcohol, people say if you take 1 hour before, it is good than combining with whatever the chicken you eat. Is it correct? I feel it's not correct. First of all, don't, no, do not take it. But if one peg they are taking, is it correct to have food with it or without it?
Sorry, sir, I didn't get the question. Can you please repeat?
Alcohol taking is not correct, but if they want to take one 60 ml before the dinner, is it better to combine with dinner or separate half an hour the dinner? You may or may not know the answer, but I don't mind.
See, alcohol, we consider it as a separate macronutrient, as we know that carbohydrate and protein gives 4 calories per gram, and fat gives 9 calories per gram. Alcohol gives 7 calories per gram. So we consider it as a separate macronutrient. And what it is giving besides calories, no satiety, no micronutrients, no health benefits. So why would you like to have extra calories without satiety? It's just taste, but if you like to have, then okay. And if we talk about ill effects on our health system, then as doctors we all know what alcohol does.
Okay. And if somebody wants to eat every 3 hourly very small amounts of food and control their, because they tried all the measures, they know, but there are two methods now we are listening. One is two full diets, whatever you like, but it doesn't mean calorie deficit should not be followed. Your primary concept is what you are losing, what you are gaining. Every day it calculates. That's the message you have given. There are subdivisions that we understood. But if somebody wants to eat small meals, one concept. Second concept is one in the morning, one in the night. So how do you address these two? Do with your knowledge.
Perfect. If they are able to digest it, and if they it's convenient to them, then there is no issue.
How frequently your body measurements should be done while you are engaged with the coach or the nutritionist or the gym specialist?
See, body measurements, I would say like every 8th or 10th day, empty stomach in morning after clearing your bowel, and in the same conditions. Okay, and weight, there is an ideal way is like you take your weight daily and then chart it out and then take the weekly average. This is the ideal way to track your weight, but many people get tensed when they see fluctuation in weight daily. So it's good to take weight also on a weekly basis.
Last two questions. Perimenopausal women unknowingly or knowingly lost lot of career not doing any exercise, have taken food. can they start again with enthusiasm weight training safely without any estrogen supplements?
Definitely. I would highly recommend this. Please, please, whosoever are hearing me, if you are in this phase, or you are a gynecologist, or you are coming across such women, please encourage them to start weight training. It's a I have mentioned that how to begin section. You have to start with minimal and gradually and progress. So I am also 42. I have started weight training in last 2 years only, and I will keep on progressing only. So don't worry about this. It will help you immensely, undoubtedly.
Okay. Last question. The children, particularly girls and women, are brought up in such an environment in India that they maintain up to the marriage basic metabolic rate maybe more, and they look all very thin at the time of marriage, but within short time after first pregnancy, irrespective of their profession, they gain weight, and they say that because of the cesarean section I have gained the weight, even the doctors, I must say, and after that they never look down. When this transition period, what is the message? This is the last question I'm asking. What is the message you want to give the transition from adolescent young girl in India to first child uh, woman married? What is this diet and exercise transition? What is the message you wanted to give, madam?
See, first of all, I would like to mention that gaining weight after deliveries is not, some rocket science. You are eating more than your maintenance. That's why you are gaining weight. Simple science. Excuse me. Not cesarean, not delivery is making you fat. It's just your calorie consumption. So, other thing, yes, right. We don't, bring up our children in that ways that we encourage them to focus on training as along with their studies. We never encourage them to go for weight trainings, and there's a very high misconception in the society that children should not weight train, but there are many research papers and there are many meta-analysis regarding the benefits in weight training starting from the very early age, even from the age of 7 to 8 years. So it's better to get engaged in such activities. There are so many online and real classes for such activities, so it's always better to encourage them. My daughter is 11 years, and I have put her in strength training, and she's doing wonderful, and her strength in tennis and other activities, her concentration, her happiness, or overall things have improved.
So the children at the age of 10th class itself do not confine to the books and keep at least 1 hour, 2 hours for the exercise, and the same principles of diet and exercise will apply to them. Just because their base metabolic rate is more, they cannot eat and sit for a long hours. This is what you wanted to give the message. Perfectly. You are quoting your own daughter example. Thank you very much, madam. Such a wonderful lecture. And because you have recently become basic coach in no conflicts of interest regarding FITTR, no conflicts of interest regarding your coaching. But only thing is that some get motivated. As you said, motivation will not maintain for a long time. Some get motivated. Do you have any office number or the how can at least gynecologists they want to approach you, not by your personal number or by mail, anything? If you sell, we will type, otherwise no problem.
So they can ping me on Messenger, or there is a live chat section on the FITTR app. They can send me notification.
That is the best, no? Twitter app on your name, they can send the messenger or the live chat, say this thing. Okay, that is the message to all the audience. Thank you, madam. On behalf of Preeti Urology and Kidney Hospital, this is the second session we are doing. Actually, the pure urology is maintained only academic sessions. I have not posted this in pure urology, but they will be listening through the YouTube link of the Preeti Urology and Kidney Hospital. Those who are interested to occasionally we will do, not regular basis. If you are a subscriber of Preeti Urology and Kidney Hospital, this link can be opened anytime and you can see the entire link. In between, we have paused for 3 to 4 minutes because my primary laptop got disconnected due to the electricity issue. I'm sorry for that. Thank you very much, madam, being with us. Once again, great session. 300 audience have seen this session, and hopefully many more get benefited tomorrow by this session. And Rekha Tandon and Gayatri, they told that. Thank you very much for an excellent session. Thank you very much, madam. We will conclude the session. Great.